Good evening and welcome to another edition of HealthLine. I'm your host, Karen Boudry. When you think of cosmetic dentistry, you might think it's all about looking better, right? Well, not necessarily. Cosmetic dentistry can also improve the health of your teeth. And one of the dilemmas we face today is our diet. There's also aging and things some of us don't even realize we do, like maybe grinding our teeth. So tonight, we're going to look at tooth dangers, how you can avoid them, but also what to do if your teeth are damaged. Joining me now is Dr. Corky Wilhite of the Smile Design Center in Metairie. Welcome. Thanks for being here.
Thank you very much. Happy to be here tonight.
Tooth danger. The very first thing I think of is something that you've taught me for years and years. Don't use your teeth as tools. And I've told that to my children. I tell it to my husband. I tell it to people I see, trying to open bags of chips. Don't do that. But
that is dangerous. And there are a lot of tooth dangers, but that's one of the most common things that people do. And most of the time when people use their teeth as tools, for instance, using your teeth as a fingernail clipper or as scissors to open a bag of potato chips, or chewing on ice, or biting, cracking a pecan or a crab claw, something like that. You might only have a minor little chip or something that happens occasionally, but over years and years of doing that, it can really end up making a difference in your smile and making your teeth less healthy.
And why is it? Because it wears them down or can actually crack them, that kind of thing? People might say, well, what the heck do I have teeth for? They're hard.
Right.
They're supposed to chew on things and bite through stuff.
Well, and certainly they are hard enough to do that. Most people who use them as tools find that that's pretty effective for that. But, I guess as we evolved and our teeth were being used for that all the time, we often only lived till about 30 years old too, so it was able to not be a big deal. But today, as long as most people are going to be around, you want to protect your teeth and help them stay healthy for your whole life. So that's something that I've told people for years is don't, use your teeth as tools. The other thing that I think is just as important in terms of taking care of your teeth, and this really goes for whether it's teeth that are natural, whether you have bonding or porcelain on your teeth, it's the same basic rules, is you don't use your teeth as tools, and if you're a tooth grinder, which about half people are, you should wear a nighttime appliance when you're sleeping.
Gotcha. Well, let's take a look at some examples of people who have some issues with their teeth that you were able to correct and help them with, obviously looking better as well as making the health of the teeth a lot sturdier, stronger. So tell us what was going on in our first case here.
Yeah, so this guy's a pretty typical tooth grinder. His teeth were wearing down. He's not an old guy, but his teeth were getting shorter and he was having some damage because of that. So part of what we did was, in restoring the teeth, we lengthened them to make them look better too, because the longer teeth look younger as well. But it was also to give him his bite back and make them function properly. Now, he's wearing a nighttime appliance when he sleeps, because that's something that people, almost all people who grind their teeth do it more when they're sleeping than at any other time. But you can see in this close-up view how much those teeth have shortened. Teeth should never look that short.
No, he looks like he doesn't have a lot left up there, and to try to bite into an apple or something would be pretty precarious for him.
Yeah, because the shorter your teeth are at this point, they're definitely at higher risk for more problems as well. So putting teeth back gives him something that's, without a doubt, stronger, healthier. He still should be careful to keep them healthy, but that's, really important to make sure that that's done. These are bonding too. If you look closely, this is a type of bonding we've talked about in the past called enhanced bonding, that makes it look as good as the natural teeth or as good as porcelain. Transitional bonding is another type of bonding we do sometimes that is a little less perfect. It's a little more basic, but still makes a big change. But he opted to do that enhanced bonding. And again, a guy who's just looking not as healthy, and then you put the teeth back. But again, for him, it was certainly part about looking good, but it was definitely mostly about protecting his teeth and making sure that he, was going to be able to keep his teeth for the rest of his life, because he's probably got a lot of years to go yet.
And now he's got a nighttime appliance to protect that investment, as well as, make sure that his teeth are going to function for the next.
And that is really important
years.
because if that's one of the things that I tell people all the time in a situation like this is if you don't do what, let's see, the best way to put it, I guess, if you don't control what caused the problem in the first place, it's going to happen again.
Sure.
So in his case, it happened before. He didn't realize it was happening. It was gradual, but now he knows, and so he's paid for new teeth, but he doesn't want to have to do that again for a very long time. So he's wearing a nighttime appliance. That's something that most people get used to pretty quickly. It's not a big deal, and for the protection it gives, it's so worth remembering to put it in at night. It's
Gotcha. And it's like it's just a little plastic tray thing, right? I mean, in most cases, it's something
They're different
pretty
types,
simple.
Different types,
okay.
but it's usually something that fits over most of the time upper teeth, and it should be kind of a hard plastic. There are certain types you can buy in pharmacies and stores that are soft plastic, and those can be good for a very short time, but the soft plastic night appliances that are kind of, you boil them and heat them up and then you fit them to your teeth, those are very harmful for the long term because your mouth, when you're sleeping, if there's something soft in there, it thinks it's supposed to clench and chew and work. And it can actually begin to put so much pressure on the teeth over a long period of time that teeth can start to shift and move. And that really is a problem.
Yikes, who would have thunk? So that's something to really discuss with you. Don't just go run off and get a nighttime appliance at the drugstore. So
if someone's having a type of issue where all of a sudden their TMJ, the temporomandibular joint, starts to really hurt, to buy one of those until you have a chance to get to the dentist for a few days or a week, something like that, I think it's perfectly fine. But for the long term, when someone knows they need some sort of nighttime appliance, to use a soft one is actually could cause another problem.
Gotcha.
So.
All right. Well, let's take a look at another case, a before and after here. And again, this is when you're thinking about cosmetic dentistry, really is the best way to figure out what might work for you, but also to sort of vet the cosmetic dentist, because there's no better way to see, if they've got the skill or not to work on you by seeing what they've accomplished in years past with other patients, especially when you see how bad some of the cases are, or not bad, but difficult.
Right.
A lot of things going on.
And nice, one of the things that's really nice is any dentist who does a lot of cosmetic dentistry is definitely going to have photos of cases that they can show you. But if they've been doing it long enough, they'll probably even have a case that looks kind of like your case, which is nice. So this is a problem that this lady had who, her teeth were eroding. And erosion is a problem that happens when someone throws up a lot or burps a lot or has gastroesophageal reflux. So your mouth can be very acidic and the enamel dissolves in acid. So over time, especially if someone has bulimia, for an example, the backs of their upper front teeth get very, very thin, and then they get so thin they start to chip off really easily. This is a lady who had that exact problem, although it wasn't because she was bulimic, it was because she had 5 children, and she said every pregnancy she had morning sickness the entire time.
Can Coke or cola do this if you're like addicted to?
No question. Colas are all sodas really are very acidic, and they can do a very similar thing.
Okay.
So in her case, when she came to see me and knew she had a problem, we talked about, first of all, what happened. And if it was someone who had a bulimia issue, we'd need to figure out how to control that. But in her case, she wasn't planning on having any more kids, so we knew that her problem shouldn't recur. So we did transitional bonding first because she was really hesitant to lengthen her teeth. When I told her, she knew she needed longer teeth, but she was thinking maybe, a fourth of what I was thinking.
Okay.
And I said, you ought to take advantage of not just making an improvement, but making your smile the best smile possible. So she was hesitant to go to porcelain right off the bat. So we did this transitional bonding as a test. So once she was used to this and realized pretty quickly, oh yeah, I needed this length. This was definitely what I needed. We went ahead and upgraded that to the porcelain. And so she had her 6 front teeth done in porcelain and bleached her other teeth so that, dramatic difference. And again, if you look at the sequencing here from what she had to the transitional bonding to the, porcelain, I mean, every step of the way is an improvement, but it gave her a chance with that transitional bonding phase for a few months to really make sure that it was correct, because it's easy to adjust it. Wow. There are times when people get their teeth lengthened and they realize, maybe I shouldn't have gone that long, and we have to shorten, and that's easier to do in that transitional bonding phase than it is in the porcelain or the enhanced bonding phase.
So that's obviously a little bit longer of a process when you're going to do it like that, but when you're making the investment to make sure you get what you want and that you're comfortable with it, it's really a good way to go. How long will the porcelain stay as pretty as that? I mean, will porcelain, age with us as far as, if we drink a lot of coffee and red wine and that kind of thing, will that porcelain fade, or is that just...
Porcelain is the most durable of all the materials.
Okay.
The composite material, which we use for bonding, is still very strong, and people can expect, I think, pretty routinely, if it's done well, and they take pretty good care of it, for that to last 10 years or maybe longer. Porcelain, I think, probably will get double that on average if people, again, take pretty good care of it and if it's done well. All these materials, though, if they're not done well by the dentist, can be problematic from the beginning. Sure. Or if people don't take care of them. If she were a bulimic patient and continued that problem, it's going to damage the porcelain as well as tooth structure.
I see.
So I think that our teeth over a period of 10 and 20 years are probably almost in everyone going to change at least a little. Porcelain and bonding will continue to change as well. But with good maintenance, whether it's natural teeth, bonding, or porcelain, people can maximize that and help to minimize any changes that they need to do in the future.
So we're talking about tooth dangers, things to watch out for, things that cause problems, cause breakage, and things that may really need kind of a cosmetic makeover. What about cavities? And I know there are things that happen disease-wise and problems in your mouth that are obviously dangerous for our teeth, and of course people have accidents too, and how do you handle those kind of cases?
Well, I've got examples of both those to show. And
kind of thought you did.
The first case that you're going to see is somebody who has cavities. Now, this is a teenager who had braces for a long time. Kids at that typical age of getting braces are notoriously bad about taking care of their teeth. And they don't listen to the reminders by their parents to go brush their teeth. They brush too quickly, ate probably a poor diet. And when he had his braces taken off, he had some cavities underneath. And it was really, for any parent, this is heartbreaking. And so in a case like this, we've got to make sure we get him, his oral hygiene under control. And so he knows how to brush and clean his teeth well. But we were able in his case with just taking out the decay and putting in some, tooth-colored fillings, which is made out of composite, the same as bonding material. And then lengthening his teeth where he'd also chipped them and worn them, so that he had something that was, much, much healthier. And, if you look at this close up, I mean,
thank you
this
for
is
that.
really, if it's dinner time,
Yeah, right.
But this is something that you could, would only get worse pretty quickly if it wasn't corrected. Right. And again, it's not just about doing the fillings or bonding, it's about making sure that the patient knows how to protect things as well. But what a difference it'll make in a person's outlook on life, really, and everything, when you can make them feel, healthy again. And of course, it's something that in his case, hopefully he learned a hard lesson, from this, and will really maintain the health of his teeth in the future. Getting your teeth cleaned a couple of times a year at your dentist, making sure that you're spending time brushing. I recommend people brush, when they do their best brushing of the day, that they brush for 4 minutes. Now, that is a really long time, but it's something that really takes that amount of time to get the plaque off all your teeth. With an electric toothbrush,
I was just going to ask you, is that better?
It is better, and I think that people who use an electric brush probably can do less. Almost all of those today are kind of built on a 2-minute timer, and if he had had it, an electric toothbrush and used it for at least a full 2 minutes before it turns off automatically, he probably would have been able to avoid a lot of this. Certainly in a case like this, you're almost always going to have diet as something that's involved as well. Kids today, especially, I mean, there are adults too who drink a lot of sodas, as you asked a minute ago, and sodas are already, they start off being very acidic. And so even if you're drinking diet sodas with no sugar at all, the acidity in that soda can allow the plaque in your mouth to become so much more powerful and do so much more damage. Besides the fact that the soda on its own can dissolve the enamel. And I've seen patients that are drinking, you know, a lot of soda, and when I say a lot, I'm thinking more than 3 or 4 a day. But I've seen people that drink as much as like 2 liters a day, you know, of soda, and it's truly something that is debilitating. I don't know if it'll happen, but I sort of think that one of these days we'll look back on sodas like we look back on cigarettes today in terms of the health damage that it causes.
Well, you've seen them take it and pour it over to clear corrosion on a battery, and that just, you know, I'm putting that in my mouth.
Exactly.
Yeah. All right. So we have another case to look at. What was going on here? What kind of tooth danger in this next case are we talking about? Is this an accident?
It is.
We're talking about? Okay. Good guess.
Little trauma here to see how this patient fared. She had actually injured her front tooth years ago and had a couple of crowns or caps put on those 2 teeth, and then had another injury that caused one of those to require being extracted. So
was this like a car accident kind of thing, or just getting hit in the mouth, basically?
Yeah, you know, it can be a lot of different things. I've had examples of car accidents, people who get hit in the face with a baseball or fall down, swimming pool accidents.
Gotcha.
There's so many things, right, that can happen to our teeth. But she needed to have that tooth extracted, and we had to do a bridge. And so from this tooth to this tooth, this is a 3-unit bridge. So it looks just like 3 teeth, but they're connected together. Then we did this 4th tooth here so that we could make it all match. And she even did a little treatment on her 3rd teeth so she could have the prettiest smile possible. But one of the things that's real important here, because of that tooth that was traumatized so badly, and she lost not only the tooth, but some of the bone around the tooth, and that caused a defect in the gums. So this bridge has pink porcelain here. What you're looking at here, where I'm showing the little arrow, is pink porcelain. It's not actually her gum tissue. And yet, if you, do that carefully, it can look just like real example. Now in this view, where you're looking at it closer, you can tell better that that area is not her real gum tissue. This is pink porcelain. But when her lip covers most of that and she's smiling, you know, you can't, you know, really see that that's not her real teeth at all.
Wow, and crazy tricks of the trade there that I would never. I see. Oh, I can see it better there. Yeah.
Yeah. So she took advantage again of having this trauma to go ahead and get the rest of her smile fixed. You can see where she's had some gum recession and such going on some of the other teeth.
Well, it's amazing too. I'm looking at the coloring and the shadow and the translucency of what you did for her, and it looks so incredibly natural. I mean, it's just amazing. Those look like the teeth she was born with.
Yeah, and it's so true that if you're really careful, you can make them look natural. If you look at this old crown up here, not to say that that's a terrible crown, you do see a little translucency in here. But when you compare it to what's down here, the subtleness of the translucency, which means the tooth gets naturally a little thinner there, so you normally would see through the tooth just a little bit to see some of the darkness of the back of the mouth. And then you have what we call the body shade of the tooth, which is the brightest area. And then near the gum line, it should have a little more color, usually a little hint of yellow there. That just helps it blend into the gum line so that it just looks real. And when that's done well, besides things like that relate to smile design, like the proportions of the teeth. If you look at the crown on the top, it's very much out of proportion. The width and the length are about the same, where healthy, youthful front teeth should have more length and width. And we've talked about width to length proportion before and that sort of thing.
Right, those don't look, you know, they just don't look proportionate, you can tell.
And so again, you know, her smile was definitely something that bothered her, and when we're able to fix that for her and really give her something, I mean, you can just see that she's happier to smile. It's not that physically there's a huge difference in the way she is smiling, but you can just really kind of see it in her eyes too, that there is more confidence about that smile.
And it just looks so natural, because obviously when you look at the before picture, you immediately say crown. And it's just a fact. Most of us can look at that and say those, she's got caps or crowns there that whereas the after picture just looks natural. It looks like she hasn't had it. If no one had seen the before picture, they'd have no idea.
That's very true. And that's one of the things that I think a lot of people who maybe are thinking, should I have porcelain veneers or bonding or even crowns if they really need it? They're maybe hesitant to do it because they're afraid it isn't going to look bad. But the thing is, you typically only notice the ones that don't look natural, right? You notice the porcelain veneer cases that look bad or don't look natural, and sometimes they're just too white or too big. But when you go to a cosmetic dentist who really has a lot of experience and who listens to what your goals are, those things can be, done in a way that it really will fool people. Still look beautiful, but still look like they're real.
Gotcha. And I think a lot of people appreciate that. They want to walk into a room and not have people say, "Oh, I can tell you've had cosmetic dentistry." They just want to look good, so feel better about themselves. So let's take a look at another example. What's going on in this case, Corby?
Well, you also asked about sodas, and we were talking about that. Mm-hmm. So this is actually a patient who didn't have a perfect smile to begin with. He had some gaps, but he drank lots of sodas. I don't remember exactly, but it was shocking. And once you kind of start doing a little bit too much and then you get addicted, I really think sodas might be addictive. But at any rate, he drank so many sodas that he really thinned out and shortened his teeth. So we did close the spaces. Wow. We made the third teeth look less pointy. And those third teeth, the eye teeth or canine teeth, are supposed to have a bit of a point, but obviously his looked a little too pointy. Right. So we made him look a little wider at the same time. So this was definitely a huge change. It even had, in his case, affected his bite to the point if you look at how these front teeth come together, you can tell that the top teeth don't overlap the bottom teeth. A normal bite, a healthy bite, is supposed to have a little bit of overbite. The top teeth overlap the bottom teeth a little bit. That protects our bite. It helps us look better, work better. In his case, he had lost that. So when we restored his teeth, and this is bonding on his upper teeth, we were able to give him that little bit of overbite back so the bite works like it should now. And that's just hugely important in the long run. It typically doesn't bother people in the short run, but in the long run, it's a huge factor. And here a young man who definitely isn't improved his appearance at all by his smile, and now we've got something that he can really be proud of and comfortable of.
Yeah, just attracted. He's a nice looking guy, but you immediately look at the before picture and say, wow, he's got some issues now. It looks just natural, and it's just a huge difference for the guy. I'm sure he is happy as can be with that.
You can imagine that someone is going to hold back from smiling, and even if you're not showing teeth that look like his before, if you're holding back, it affects our appearance in a way that people can kind of feel, and sense that there's something not right there. And then if something does really make you laugh and you're showing teeth that look unattractive or detracting,
there you go.
then that's something that it just can totally change a person's outlook on life and their personality.
Okay, we're talking about tooth dangers, things that maybe some of us even don't realize are causing problems with our smile and the health of our teeth. I think we have time for another case here. What's going on in this one?
Well, one we haven't talked much about at all is tobacco.
Oh, yeah. Okay.
Smoking is something that can make teeth look dark. This is a guy who had some stains on his teeth, which are pretty clear here. He also had some white spots, which aren't caused by tobacco. That's something that is either genetic or developmental, typically. Sometimes it's caused from braces and the people not brushing well. In his case, it was a developmental thing. So he'd had that white spot his whole life, but he was a smoker, and now the dark on top of that is really making everything look bad. So this was pretty simple in his case. We only had to clean his teeth to get the stain off, and then on the two front teeth where the white spots were, to do a little bit of bonding. So most of the teeth you see here are still his normal teeth. It's just that the area where the bonding is just right in this area. The rest of his tooth is a natural tooth. And so it wasn't necessary to do much treatment for him. And then he was working on quitting smoking. But what a nice difference that makes too.
And you didn't do that much at all. So there are people like, now you would have, if you had your druthers, you would have said, oh, let me bond and do all of them if he wanted to, because you could improve the look a little bit on the sides too.
There are other things that could have been done.
But wow.
So many people, have an aspect of their smile that bothers them. And when they come in to see me, they're concerned about one or two particular things, even though I might be able to give them a list of 10. If they really only need those one or two things done to make them feel good about their smile, I think that's the appropriate thing to do.
Sure.
I think it's important to let people know what other things might be done so they're just aware, and so they can judge for themselves and make that decision whether or not they want more. But many people only need one particular thing done.
That's really, really nice. And that's tobacco.
Yeah, so tobacco is a big stainer. In his case, he'd been smoking long enough that he also did some bleaching. Almost everybody, before we do bonding or porcelain or other treatment like you see here, will bleach first, just because it's so cost effective. There's nothing more inexpensive to do than bleaching your teeth. And people can even do that on their own. They go out and buy Crest white strips, which are...
Do those really work?
They do, and they've improved over the years. There's not, I don't think, quite as effective as the technique that a dentist can do with a custom little bleach tray that fits over your teeth, that allows you to have something that, you just put just the right amount of bleaching gel in, and you can go back as far as the tray goes, whereas Crest white strips don't quite get to all the teeth, but they do work.
Wow, that's nice to know, because we've talked before about the bleaching trays and different over-the-counter things, so it's nice to know that some of that stuff, if you want a kind of a quick fix, you can go buy it over the counter. But nothing compares to seeing a cosmetic dentist and really looking at the options and things you can do. And as we've seen, there's a wide range. You can fix a little bit, you can fix a lot. Just depends on the case. Thanks so much for being here. We'll get to that case next time. More information about tooth dangers and correcting problems that may arise is available from Corky Wilhite's office. It is the Design Center in Metairie, 831-1131. They'll be glad to fill you in on more about what we talked about tonight. Thanks for being with us. Have a great night.